These past few days, a big deal is made about Maria van Kerkhove saying it's rare to have asymptomatic carriers transmit the coronavirus to other people. She later retracted her statement and the WHO said basically she's wrong. Everybody's talking about it. Dr. Fauci came on directly and said she's wrong, except in nicer terms. Well, why do we care? Why is it such a big deal if asymptomatic cases of coronavirus can spread the disease? First off, what does asymptomatic mean? Somebody who doesn't have the symptoms. What if somebody has a headache? Is that a symptom? Suddenly you feel dizzy? Is that related? What if your right foot hurts? Is that relevant? Take a look at this man. He seems like a normal, healthy man, right? What about this man? He has diabetes. He's not a normal, healthy man anymore. Well, except I use the same picture. Yes, it's a Korean actor. I don't know whether he has diabetes or not. But the point is, you can't see whether somebody has diabetes from just looking at them from the outside. Symptoms don't diagnose diabetes. A glucose test does. If you look around, there's many different recommendations for wearing masks. One doctor from Mayo Clinic says you should wear a mask if you're sick so you can prevent transmission to others. But if you're healthy, there's no point. I have to point out, first of all, that she's wrong in saying prevent transmission. It's reducing transmission. And also that she's wrong in saying there's no benefit part. We'll talk about that more later. But anyways, this is one person's perspective from the Mayo Clinic. On the other hand, the Cleveland Clinic publishes a list of 5 myths about a coronavirus and says the opposite of what this other person from Mayo Clinic says. This doctor is specifically talking about cloth masks. In myth number 1, that wearing a cloth mask is no use, he says there's studies showing cloth masks reduce the microbes you spew into the air. It's beneficial to reducing how much virus you put out. And number 2, he says, if you're not sick, you don't need to wear a mask. Well, there's reports from China about asymptomatic transmission. China, who's had this a lot longer than us, knows a lot more about it, meaning people don't think they're sick, they don't feel sick, but doesn't mean they can't transmit the virus. Why should you care about this debate? Why is it such a big deal asymptomatic spread of the coronavirus is possible? Because social bubbles may be coming soon to a county near you? It's this concept you could have a group of people you interact with. You should only interact with them. But with them, you don't need to worry about social distancing or other measures. Imagine you live in a bubble. You can now invite other people into the bubble, and they'll remain in your bubble. This is the actual meaning of social bubbles, an exclusive group that only has members who interact only with each other, nobody else. And if somebody gets coronavirus in a group, the only people affected would be that group. The thing is, we already had social bubbles. They're called households, the people we live with. China actually didn't allow people in Wuhan who were infected to stay at home. They took them out of their house and isolated them. But in the US, people mostly stay at home. Unless they're too sick, then they go to the hospital. Even with shelter in place, we still have transmission of coronavirus though, without social bubbles. How? Let's take a look at this picture. Everybody's in their own little bubble in this park, literally. A chalk line drawn through the grass. The man selling ice cream, however, goes between bubbles. When you interact with him, you're coming out of your bubble. During the shelter in place, people went out to grocery stores. I went to the grocery store. I don't know who has the virus, who doesn't. You take precautions, but still, you may get it. If thousands of grocery workers have it, where do you think they got it from? Is it possible they could have gotten it from one of the thousands of customers they interact with, and also given to one of the thousands of customers they interact with? Of course. What about restaurants where you get your food? Do you think if somebody has the coronavirus, they could pass it on to you through the food? Of course. This is Andy Richter at the famous Pok Pok Empire in Portland, announcing he's closing all his stores. Because one of his chefs died from the virus, he can't subject his employees to this risk. There's many more reports of restaurants closing because somebody tested positive for the coronavirus there. If this boy wiped his nose with his hand and then wanted to shake your hand, would you shake his hand? Of course not. The problem is the coronavirus infection often doesn't show itself this way. It shows itself like this. Nothing. Nothing indicates he has it or he doesn't, which makes it hard to choose your social bubble group because you expose yourself to somebody who has it and you may get it, even if they're asymptomatic. This is a graph of TB transmission. TB is a little bit different than coronavirus because it's mostly transmitted via the airborne route, aerosolized, but I think it illustrates some very important infection control principles. As you can see, a lot of the risk of transmission depends on how much TB there is in the air. And thus, ventilation, moving, and clearing the air is very important. The prevalence or how much TB there is in the community also matters. And last but not least, the top right graph, duration of exposure matters. The more exposed you are, the higher risk you are. And obviously, social bubbles may be quite intimate. In the US, the main concern with the social distancing is whether lovers can meet. It seems to me, though, this rule doesn't actually do much to help some people, because many times we read a British news, and lovers actually means people having extramarital affairs. What I don't get is having a social bubble not being an extremely high risk activity. They say it's basically like inviting this person into your household. They come into your house, you're indoors, you're not going to wear a mask, you're not going to keep any physical distance, you'll sit on the same couch. According to this chart, that would be a high risk activity in basically every measure. Why would you do this without testing? The County of Santa Clara has put out guidelines for testing, and those people who are asymptomatic should still be tested in certain cases, mainly because they don't want to be unknowingly transmitting the disease. These people are exposed to many different people. They're at high risk for transmitting it. They know here that some people also should get tested repeatedly. They haven't caught it in the meantime, in between test periods, specifically pointing out staff at nursing homes. Sometimes you hear stories like this. A woman finds the perfect man. It's not till years later she figures out he's a murderer. Why didn't she know before, you might say? Well, maybe because there's no physical signs of being a murderer. He was handsome, polite, had a good job, treated her well, everything you'd want from a man. But isn't it similarly silly inviting someone into your social bubble, not knowing if they're positive for the coronavirus? In China, they tested all the citizens of Wuhan, all 11 million of them. They only found 300 asymptomatic cases. They said, don't worry about them, they can't transmit the virus. But what they actually did was isolate them all. Were they just playing it safe? Shouldn't we too then play it safe and not let asymptomatic carriers spread the virus within social bubbles?